Smoking at an early age has several detrimental short and long-term health consequences. According to World Health Organization statistics, teens who smoke are 3 times more likely to use alcohol, 8 times more likely to use marijuana, and 22 times more likely to use cocaine. As well, smoking at an early age is associated with an increased risk of lung cancer and most smoking-related cancers. Additionally, teens who smoke are more likely to have sought medical help for psychological reasons and are more likely to engage in a host of risky behaviors such as physical fights. The Prompt Intervention, which stands for Participatory Research in Ottawa, Management and Point of Care for Tobacco Dependence, is a community-based participatory action program which was first implemented as a feasibility study in 2016. Unlike standard care, this program consisted of free, off-label nicotine replacement therapy for program participants, access to bi-weekly counseling which was provided by expert tobacco dependence treatment nurses, access to a safe, non-judgmental space for monthly follow-up interviews with the peer researchers, as well as weekly peer-led life skill workshops which consisted of a variety of topics such as financial literacy, meditation, HIV education, cooking, and art. Results of this program indicated a mean reduction of about 11 cigarettes among study participants, a shockingly considerable reduction and in some cases cessation of self-reported illicit drug use such as that of heroin and OxyContin, as well as increases in psychosocioeconomic benefits and social outcomes. Many of our participants made the decision to go back to work, to return to school, as well as make positive changes in their health behavior such as eating healthier and engaging in physical exercise. In line with this feasibility study, which was carried out by the Bridge Engagement Centre in Ottawa, we would like to scale the study to the youth population in Ottawa. Why is this important? Well, the prompt intervention tackles so many of the social determinants of health, such as building positive social support networks among our youth participants. As well, by preventing the escalation of tobacco dependence and illicit drug use earlier on, we will be preventing long-term adverse health outcomes, which in turn will lessen the burden on the Canadian healthcare system later on, not to mention improving the quality of life of our youth participants. How will this program be implemented? Well, we have partnered with 2 organizations, which are known as Operation Come Home and We the Parents. We will be recruiting youth with lived experience of tobacco dependence as peer researchers from the Bridge Engagement Centres who will then recruit at-risk youth who meet our inclusion criteria. That is, they must be between 12 to 17 years of age, part of non-mainstream school system in Ottawa, they must be smokers who have used drugs in the past year, and of course they must provide consent to participating. As well, they should not be accessing any rehabilitation or smoking cessation program. Our peer researchers will then administer iPad-based surveys both at baseline and at the end of the 6-month intervention. They will be collecting information on tobacco smoking behaviors, measures of respiratory health, mental health, and quality of life. Some of the surveys that they will be using to measure these health indicators include the Fagerstorm test for nicotine dependence, the Bold Core questionnaire, which evaluates respiratory symptoms, the Chronic Obstructive Pulmonary Disease Assessment test, the Patient Health Questionnaire, and the Generalized Anxiety Disorder Questionnaire to assess mental health, as well as the EQ5D3L questionnaire to measure quality of life. They will also be conducting 2 point-of-care lung function tests and handheld spirometry and oscillometry. On a monthly basis, the peer researchers will also be collecting qualitative data about tobacco smoking status, as well as barriers and facilitators to the smoking cessation program. We will then be using statistical analysis to measure the change in baseline cigarette purchases, cigarette use, drug use, as well as self-reported health conditions compared to what we had measured at baseline. We will then be using thematic analysis to analyze any barriers and facilitators to the smoking cessation program throughout the 6-month intervention. This study is going to be led by myself, as well as principal investigator and respirologist Dr. Smitha Pakal, who is also the executive director for the Bridge Engagement Centre. We anticipate receiving $30,000 of funding through the United Way Ottawa organization and MyTax Accelerate. We are at the early implementation stage. Our study has been developed. We are just waiting on finalizing funding before beginning our study. We are looking for partnerships, grant suggestions, and funding. We have recently partnered with organizations in Toronto, Omaha, and Chicago, and we would like to raise awareness of this highly effective community engagement approach to harm reduction. Thank you.